such as tuberculosis, Hospital, School of Nursing, and the Kampama Mental Home. Known as Venture, 2 kilometers from Banjul, was first created in 1913 and closed in 1928, then reopened in 1940. At around the same time that Royal Victoria Hospital, Bansang Hospital, School of Nursing, and the Kampama Mental Home were established.
As early as 1919, the Gambia Colonial Medical Report stated that TB, venereal diseases, and amoebic dysentery, all communicable diseases, were on the increase in Batos, now Banjul, and surrounding areas. The report went on further to state that TB was introduced by the Europeans into the Gambian community and has since become widespread due to the groundnut trade. The dust from groundnut threshing has fine and highly irritant particles which causes the disease. Another reason forwarded by the 1919 medical report for the spread of the disease was poor ventilation in many Gambian homes. Example, lack of windows, which restricted air circulation. The third reason given was that the disease was spread by Batos people who traveled upcountry from December to May to trade in groundnuts. Thus, major trade centers like Kuntaur, Georgetown, and Basse were the first areas in the rural areas to be affected by tuberculosis.
Furthermore, in 1920, there were 250 cases of tuberculosis recorded in Batos alone. Now, and 30 of these were referred to the sanatorium. In 1939, tuberculosis cases made up 3% of all cases treated at Gambian medical facilities. Now, these facilities were Bansang and Batos hospitals, and 9 deaths were recorded from tuberculosis in 1939. Now, 21 deaths were recorded from tuberculosis in the 2 hospitals, and 193 outpatients were recorded too. The serious overcrowdedness of Batos, which is present Banjul, during the Second World War, this was due to the massive influx of villagers looking for jobs in town, also increased tuberculosis and other communicable diseases in the population, which prompted the government to reopen the facility, which was closed earlier on. It could be quite amazing also to note that no Europeans were housed at the sanatorium during the colonial period. Now, whites who had communicable diseases were treated at a separate ward at the Royal Victoria Hospital. Otherwise, returned home to their native home in England. For a very long time, the sanatorium was so underfunded that it depended on the goodwill of Samaritans like wives of colonial governors and Christian missionaries for it to survive.
As the years passed, due to numerous factors, it suffered a degree of neglect, thereby struggling to satisfy the demand of the populace and was in urgent need of resuscitation. It was then that Trust Bank took up the challenge to give the sanatorium a new lease of life and has since carried out numerous constructions and refurbishment works amounting to over $7 million.
Well, I could tell you that, the Ministry of Health and Trust Bank, the relationship has been a long-standing one. Historically, to take you back, it started in 2003. The major intervention really is the sanitarium at the Mile 2 Bond Road. I had a privilege to visit the sanitarium, and really, according even to my staff, that have seen what the sanitarium used to look like before Trust Bank intervention, there was a marked difference. One, Trust Bank constructed the perimeter fence at the sanitarium.
Before the intervention of Trust Bank, this place was totally bad. It was not like how it was today. There was no proper securities. Animals, dogs, thefts were all coming in. A lot of things were missing here. Patients were escaping, going out. There was no control for them.
Time I was fini 82 la new stop new for another interview. New once February 83. When you belegi fi place doy war la won. Lekte head disposal work building me fi nim melon bobu ñi head bu nahari mo fi neka préparer maraja ngi tilim.
They replaced the asbestos roofs, which was quite good because it is known and it has been scientifically proven that asbestos can cause cancer, and hence replacing the roof was really necessary, and of course the general painting of the premises. Trust Bank, I understand, also built a standard mortuary to reduce the burden on transporting corpses to the RVTH.
When they built us the mortuary, it has saved us traveling the corpses to RVTH mortuary. Everything is done here. Everything is carried out here.
Legi biñ paré ñu bilal ñu lifin mortuary loolu yëpp amu foon mortuary bu mu njëkk ba léegi amoon dafa màggetoo so da ngaa gis ne su fi nit gaañoo sax dañoo am pour deenay dox dem ba Banjul amuñ transport ba pare communication itam problème la woon dañoo dox dem ba Banjul pour mun a jël néew yëpp ko mortuary fële.
Also, renovation and refurbishment of both the male and the female wards. They also made provisions for beds, mattresses and lockers, renovation of the ceiling with modern fittings and lighting.